Hey, it's Casey here, GP and founder at MBS Pro. I've got a really exciting update that we're working hard on. Hopefully, we're going to deliver it in the next couple of weeks. I always say a couple of weeks, and then it's a little bit longer, but a couple of weeks. We've been approved via Services Australia with some of our integrations. Now, you're probably aware that we have a huge amount of other Services Australia integrations into Medicare, so things like pro item checks, PBS authorities, My Medicare checks. This one we're really excited about, really excited about. It's our My Health Record integration, which essentially builds out a whole picture of your patient that you're seeing, including their past medical history, their imaging, their pathology, what they've been prescribed, what they've been dispensed, any shared health summaries, care plans, discharge summaries, etc., all in the one platform. We think this is going to be really helpful for a whole heap of different use cases. Imagine you're an ED doc and a patient comes in at 2 a.m. and you've got to figure out what exactly has gone wrong. Now, it'd be really easy to figure it out if you had the bloods from the GP the day before. Imagine you're a specialist that's been referred a patient and you've got some of the bloods from the GP, but the patient has actually been to hospital about the same condition that they've got just recently, and there have been some other bloods and imaging done that you are not aware of. Or imagine you're a GP and your patient has gone into the hospital, they've had a whole heap of things, changes, medications changes, bloods, imaging ordered, and a discharge summary with a whole heap of follow-up, and you have no idea what's going on because you don't have that discharge summary. Now, all of that can be processed and seen very easily, very quickly, with the complete picture all in one place at MBS Pro. This will make a huge difference to the way that we practice medicine, and I think it'll make things a lot safer. It'll go a long way to solving the interoperability in the context of clinician use, where we can see the whole picture of a patient, see exactly what is going on, and hopefully make things more efficient. It's really easy to figure out what's going on with the patient if you've got the whole context, the whole story, their medications, their past medical history, and we can use that to create a picture and figure out what is going on a lot quicker than if we had none of this information at all. So you can see here, I'll give you a little bit of a demo. We've got a pharmacist shared medication list. So a patient has just had some things dispensed. They've got a shared health summary that might have been uploaded from their GP just recently. We've got a nephrology letter. So they've been to the hospital, to the nephrologist, and there is a letter here. Not all of these things come back immediately when they come from hospitals, but if it's gone into your My Health record, it's there instantly, which is super helpful. We've got a GP mental health treatment plan, which is useful to know if a patient came in an acute mental health distress into an ED. We've got all of their diagnoses and previous medical history. We've got all of their pathology across multiple pathology providers. You may be aware that there is now sharing by default, so that means that all imaging and pathology goes into your My Health record. This means that whoever orders it, we can see this on MBS Pro, again, making this significantly more efficient to serve our patients. We can see all of bloods, urine, imaging, etc., and then medications and dispensing history. The other handy thing, and perhaps this is more of a GP or private thing, as in someone who doesn't work in the hospital, but you can also see their entire billing history. So we can see when a care plan was done, where it was done. We can also see any allied health sessions associated with the care plan, which is a real pain. Have they had 4 sessions, 5 sessions? I don't know how many sessions they've had. Health assessments, which is another thing that we could previously not see and know if it had been done. And then remembering we've got our My Medicare check, which will check where a patient has been registered for My Medicare, and you can quickly register a patient for that as well. So more to come with this. We're building this out to be an incredibly useful tool. Hopefully that gives you an idea of the really useful use cases, and stay tuned for more at mbspro.com.au, where we have free trials of all of this. Thanks very much. Bye.